Hi, class. I wanted to do a short lecture on houselessness or homelessness. I know it's an issue that a lot of people are interested in, and not surprisingly, it's an issue that sometimes confronts students directly in their own lives. And I wanted to talk just a little bit today about the general picture of homelessness and how COVID has impacted this issue. Of course, Portland is a place where it's kind of an issue that's right in people's faces. If you go downtown, if you go on an off ramp and see someone with a sign, if you see the number of tent villages that have popped up around the city, you know this is a continuing problem, and it's a problem that Portland as a city has wrestled with, but the country in general has. Just to sort of start the framework, when we talk about poverty, this is tying into our section on poverty. Um, we think of poverty in kind of two ways. We think of poverty in terms of absolute poverty is sort of the first way we think of poverty, and that's when people don't have the resources for the basic elements in that Maslow's hierarchy of needs, which especially food and shelter. People are hungry, people are in the elements, people cannot take care of their children. And usually when we talk about absolute poverty, we talk about places like East Africa or the Sudan, where there has been massive famine, and places like Darfur. We think of people who are literally starving to death. And we balance absolute poverty with the notion of relative poverty. Relative poverty is based on the standard of living in a particular society, the people that don't have what's expected of the basic elements of society. So in our society, that would include education or access to education, access to healthy food, that would include health care. And in our society, we've worked on this idea of relative poverty. Sorry, Randy, relative poverty. And that's why we created this thing that we discussed before called the poverty line. That if you fall below this particular threshold of income, we're going to help you out. We're going to help you out with housing. We're going to help you out with food. We're going to help you out with some type of education support, job training, to get you to the bare minimum that we would expect. So that's the relative notion of poverty, and we contrast that with the absolute notion of poverty, which we associate with third and fourth world countries. But when we talk about homelessness, we are talking about absolute poverty. We are talking about people who don't have a roof over their head, quite literally, and people that don't have the access to food that most of us enjoy. And so it looks much more like a third world scenario when we're talking about houselessness or homelessness. So we want to talk a little bit about what the causes of that are, what the pictures are, and then again, why COVID has kind of made the situation worse. Counting the homeless is always hard. We do this every 10 years with the census, usually when we're mailing things to people's mailboxes to fill out or asking them to go online. If you are living on the street or even in a shelter, sometimes it's hard to figure out how you would be counted in the census. But we do these sort of on the street counts, and roughly there's about 500,000 Americans that are experiencing homelessness at any given time. Some of those people are living in their cars, some of those people are living in tents, some of those people are in shelters, but roughly between 500 and 600,000 people are experiencing homeless, as best as we can tell. The good news is that number had been dropping before the year 2020, and we've seen general decreases in the rate, but because the population has been getting bigger, it's actually been more people. And the largest increase in the past few years has been among young adults with children, which is heartbreaking to think about. You know, some young parents with a 3-year-old who are kicked out on the street. They make up about 14% of the homelessness. Of those experiencing chronic homelessness, the number is about 12%. So 12% are on the street kind of permanently, which is good news and some bad news, which is most people, you know, almost 80 or 90% of the homeless population are just temporarily homeless. They've been unable to pay their rent and have been kicked out, might be doing a little bit of couch surfing, staying with friends, until they can get their feet back on the ground. So the good news in general, and this is because of some real shifts we've made in policy about getting people into housing, is that most people, the vast majority, between 80 and 90% of the population of homeless are temporarily homeless, which is still living in a car for a couple months is not pleasant. So it's not to diminish the pain that those people suffer, but at least they are getting out of homelessness. When we look at people experiencing what we call unsheltered homelessness, which is, not having a roof, being out in the elements, that's roughly about 10% of the homeless population. So for all those people that you see on the street who are living in the cold Oregon rain, that's the 1 in 10. The other 9 folks are somewhere in a shelter, in some type of sheltered environment. And sometimes that includes religiously funded shelters that churches set up. That includes government housing for short-term homeless folks, but that can also include staying with friends, right? Sometimes people are staying in cars when they're staying in cars in their friend's driveway. So there's all kinds of variations about what being homeless means. But a lot of these folks are young parents with kids, which is a heartbreaker. There's a great variation in the amount of homelessness in states. It's very high in places like Washington, D.C., and Hawaii has an incredibly high homeless rate. Mississippi has a relatively low homeless rate. Part of that is a low urban population, but also people will stay with family members. And we know that there are certain populations that are more at risk of homelessness. And I think we understand this in Portland, has to do with sort of 2 factors. One is problems with the individual themselves, which can either be something like a mental health issue, on which they've been sort of pushed out of normal housing, or an addiction issue, in which they've been pushed out of housing, sometimes by their own family members. Sometimes this is a sexual or gender identity issue where they've been pushed out by their family because they're gay. I mean, this has been one of the issues with youth in Portland, that a large number of homeless youth in Portland were kicked out of the house by their family and had nowhere to go and ended up on the street, which is just heartbreaking to think about it. But the other explanation for homelessness, which is much more common, even though it gets less attention, is that people are pushed out for economic reasons. They can't make their rent. We often say you're one rent check away from being on the street. A lot of people don't have a lot of money in their savings these days. They have a lot of debt, but not a lot of savings, as we've talked about. And all of a sudden, you can't make that rent check, or you can't make that mortgage payment, and you're out on the street. And so this is the more common reason that people end up on the street, which can, change with the economy. And we've certainly seen that with regards to COVID, which we'll get to in a minute. So when we look at the causes of homelessness, I'm going to just very briefly kind of go through some of the main causes that people end up on the street. I want to briefly kind of discuss 6 of the sort of main reasons that people are driven into the street. Now, hopefully you will see this as a systemic issue, not an individual person blame issue. The first one, the big one, is affordable housing and the inability to find cheap places to live. People who live in poverty are most significantly going to be affected here. Today, 8 million low-income households pay at least half of their income towards housing. I'm going to say that again. 8 million low-income households pay at least half of their income towards housing. Half of their money goes to rent, basically. So that means if you have an interruption in your income flow, you're out on the street. So just being on the edge of being able to afford housing is something that it puts people at risk. The second is sort of people who are at low income but high risk. People who are high risk include people who have prison convictions, right? People who have been to prison and have criminal records and have a hard time finding housing because there's a box that says when you're applying for a rental space, have you ever been convicted of a felony? And even though it's against the law to discriminate against you because of the color of your skin or your sexual orientation or your gender, it is legal to discriminate against you if you've had a felony conviction. So people who coming out of prison often do not have a place to live. People who have limited language skills, or in a labor market that fluctuates, that doesn't work year-round, that may be seasonal labor, that have unreliable transportation, or have a disability. Like, these people are sort of high risk. If you're already poor and you add that high risk element to it, it's very easy to end up on the street. This is especially a big issue when we think of the 2.2 million people that we lock up in this country. 95% of the people who go to prison walk out of the prison. And if you can't find a place to live when you walk out of a prison, returning to a life of crime might seem like a rational option. We also talk about health issues. This can be physical, or behavioral, mental health issues. A person can become chronically homeless because of health conditions, including not being able to find a job because of a disability. People living in shelters. A study done by the U.S. Department of Housing and Urban Development found that people living in shelters are twice as likely to have a disability compared to the general population. The same study found that 20% of the homeless population reported having a serious mental illness. And sometimes those mental illnesses exacerbate things like chronic drug abuse. We also have people who are experiencing things like AIDS and other diseases. And as we've talked about, you can have a serious disease, including something like cancer, in which you can't afford health care, and that can suck up all the savings that you have, and you're out on the street. So health is a really big factor. Another one that we probably don't talk enough about is domestic violence. Domestic violence can drive families, especially women with children, into homelessness as they look for safety in a way to literally save their lives. Some of those people end up in shelters, those women especially. Other women might end up physically living on the street, finding ways of discovering an income that is less than legal, including drugs and prostitution. And so there is a cascade effect of domestic violence putting women out on the street. The fifth explanation is racial inequity. We've talked about how racial inequality has been built into our system. And when we look at the data on homelessness, we find that minorities, especially African Americans, have a higher percent. For African Americans, who make up about 12 to 13% of the population, are 40% of the houseless population. And that has a lot to do with job discrimination and housing discrimination and the repeated trauma of racism that we've discussed, including how that would impact one's mental health. And then the last one, and this is something that we've talked about in this class, and is certainly a big issue here in Portland, is gentrification. Gentrification is the transformation of low-income neighborhoods into high-income neighborhoods with an in-migration of homeowners, usually young white couples, and that drives out the resources for low-income people, including cheap apartments and cheap places to eat and cheap places to exist. Those spaces get gentrified, and what happens to the people that were in those gentrified spaces? Some of them find other cheap living farther away. So, for example, in Portland, we've seen an out-migration of low-income people to Gresham because you can't afford to live in Portland anymore. But some of those people who don't have the resources to pack up and find a new place in another town end up on the street. So that's just a real quick outline of 6 factors that drive people into homelessness. Now we add the pandemic that we're in right now, and it sort of adds multiple levels of problem to this situation. The federal government, if you want to trust federal data, expects there to be in 2020 a 40% increase in the homeless population because of COVID. 40%. So for every 10 people that are homeless, we're going to get another 4 people added because of the economic impact of the coronavirus. An incredible amount of people that were thrown out of mainly low-wage jobs. You're working as a waiter or a waitress. You're working, in some service sector job, and all that gets shut down for a couple months. You're out of work and you don't pay rent. Your landlord says no rent, no place to live, and you're out on the street. So a 40% increase is pretty powerful. And we know that shelters are at capacity. People who, don't want to live in the woods, want to find some sheltered environment, especially if they have children. Those shelters are maxed out. The shelters don't have a lot of resources to get people in this current wave housed. One of the things we know is that shelters typically don't have Wi-Fi. And if you are out and all you've got is your laptop, and that's going to be your tool to find a new job or find a new place to live, you're out of luck, right? You don't even have a way to connect to the world. We also know that homeless, because of things like shelters and group living, are less likely to quarantine, and therefore the disease spreads more quickly among that population. There's also less access to quality health care. If you don't have, health insurance, You're waiting you're sick enough to enter the emergency room, and hopefully you're gonna get help there. You're not gonna go to the doctor because you have a tickle in your throat. It's gonna be essentially too late. And so we see the spread of the coronavirus faster among the homeless population, which has caused a lot of fear. So one of the good things that's happened because of the coronavirus and the fear that the homeless population would be rapid spreaders of the virus is all of a sudden housing became available. All of a sudden there became a place to put people with running water and a bed. And they were essentially hotels. Hotels that weren't being used or hotels that weren't being filled capacity. In many states across the country, Washington has kind of pioneered this, Washington State. They have decided it makes more sense for the tax dollar to be used to put these folks in a safe, healthy space where they can quarantine and look for work and be out of the elements. And all of a sudden, we have housing. So the coronavirus, in a weird way, has helped to alleviate some of the homeless population by freeing up suddenly a bunch of hotel rooms. And I want to point out this issue that in World War II, we built millions of housing units in this country, including in a place called Vanport, Oregon, which in the 1940s was the second largest city in Oregon, between Vancouver and Portland, Oregon, to build housing for shipyard workers overnight. Kaiser, of Kaiser Permanente fame, built this place where 40,000 people just moved into, and we built it overnight. And unfortunately, in 1948, there was a massive flood that wiped it off the face of the earth, and Vanport is long gone. There's a golf course there now. But it shows that when there is political will, we can come up with the resources to house people. And so if there is a silver lining in this discussion about housing and coronavirus, it's created an immediate need to house people, and surprise, surprise, when people, outside of the homeless community are worried about getting sick, all of a sudden there's housing being built. So Portland has pioneered some of the zoning that allows for there to be low-income housing, and I think some of this stuff might be replicated around the country as we try to find a place for these people who are victims of domestic violence or victims of drug addiction and mental illness, or just can't find a job or a place to live after they get out of prison, to actually have a safe place to live. So that's just a little thought bubble about where we are on the housing crisis, and I hope this applies and makes sense to some of the other issues we're talking about. Okay, there's a discussion question coming up in 2 seconds.